Hello, and welcome to my presentation on rabies virus. For background, rabies is a viral zoonosis that occurs around the world in over 150 countries and is classified as a neglected tropical disease. A member of the Lissa virus family, rabies is present in several natural animal reservoirs, including dogs, bats, raccoons, and other carnivore mammals. Although there are many potential reservoirs, 99% of human infections are due to contact with infected dogs. The greatest concern with rabies is that in humans it is almost always fatal once clinical symptoms have developed. Current epidemiological evidence suggests that 59,000 people die each year from rabies infection, mostly in Africa and Asia. In industrialized countries and urban areas, human rabies is close to elimination due to vaccination of domestic dogs and other control measures. However, the prevalence is much higher in developing countries with limited access to health care. The disease is also assumed to be vastly underreported because most victims die at home. Mass vaccination of dogs and widespread immunization of humans following exposure has significantly reduced the number of human deaths from rabies. According to the World Health Organization, global market data from pharmaceutical companies suggests that over 15 million people receive rabies prophylaxis each year, and without post-exposure prophylaxis, about 320,000 deaths would occur annually. Transmission, signs, and symptoms. Human infection usually occurs following a transdermal bite or scratch by an infected animal. Transmission may also occur when infectious material, usually saliva, comes into contact with the victim's mucosa or with fresh skin wounds. Human-to-human transmission by bite occurs rarely. Another route of infection is through virus-containing aerosol or infected organ transplantation. Ingestion of raw meat or other tissue is not a known source of human infection. In the Americas, bats are now the major source of human rabies deaths, as dog-mediated transmission has decreased dramatically. Bat rabies is also an emerging public health threat in Australia and Western Europe. Human deaths following exposure to foxes, raccoons, skunks, jackals, mongooses, and other wild carnivore host species are very rare, and bites from rodents are not known to transmit rabies. The incubation period is typically 1 to 3 months for rabies, but can vary from less than a week to over a year depending on factors like the amount of virus inoculated, the degree of innervation at the site of entry, and the proximity of the site to the central nervous system. Virus particles are transported to the CNS via peripheral nerves and replicate inside the brain. Dissemination to the rest of the body occurs rapidly and spreads via the CNS to tissues, including the salivary glands. There are no symptoms during the incubation period. The prodromal phase lasts from 2 to 10 days and consists of fever, decreased appetite, nausea or vomiting, headache, malaise or lethargy, and pain or paresthesias at the site of the bite. By the time of clinical onset, the virus is widespread throughout the body. However, there's no detectable immune response at this time. After the prodromal phase, the acute neurological phase begins. This may last 2 to 7 days and includes hyperactivity, disorientation, hallucinations, seizures, stiff neck, paralysis or weakness, and characteristically, hydrophobia or aerophobia, which is an intense fear of water or air caused by pain from tightening of the muscles in the throat. Coma may also occur, lasting up to 2 weeks. During this time, progressive fatal encephalomyelitis develops, and death occurs by cardiorespiratory arrest within a few days. Diagnosis. During infection, the virus is concealed from immunosurveillance by its location within nerves, and antibodies in blood and CSF are unpredictable and rarely detected before 2 weeks. No tests are available to diagnose rabies infection in humans before the onset of symptoms, and unless the unique hydrophobia or aerophobia is present, clinical diagnosis may be difficult. Once clinical manifestations are present, saliva, urine, hair follicles, and CSF may be tested for virus isolation, or PCR, as well as antibodies in blood and CSF. Skin biopsy may also be examined for antigen in the nerves at the base of hair follicles. After death occurs, diagnosis can be confirmed by virus detection that is 100% sensitive and specific. High-risk groups. The World Health Organization estimates that 95% of rabies cases occurs in Africa and Asia, and due to widespread underreporting and uncertain estimates, it is likely that this number is severely underestimated. Most cases are due to dogs, and the burden of disease is disproportionately borne by poor rural populations. About half of all cases are attributable to children under 15. In the Americas, bat-mediated cases represent the majority of human infections. The groups that are at the greatest risk of contracting rabies are those whose professional or personal activities bring them into direct contact with bats, carnivores, or other mammals. This includes lab workers who handle the live virus, veterinarians, animal disease control staff, and wildlife rangers. Other groups at risk include travelers to endemic regions for greater than 30 days, and those who engage in outdoor activities such as cave exploration or mountain climbing, as well as children in remote high-risk areas. Prevention strategies. Education on dog behavior and bite prevention for both children and adults is an essential element of rabies prevention and can decrease both the incidence of human rabies and the financial burden of treating dog bites. Increasing awareness of rabies prevention and control in communities includes education and information on responsible pet ownership, how to prevent dog bites, and the immediate care measures after a bite. Rabies is a vaccine-preventable disease, and vaccinating dogs is the most cost-effective strategy for preventing rabies in people. Dog vaccination reduces deaths attributable to rabies and the need for post-exposure prophylaxis as part of dog bite patient care. Although effective human vaccines and immunoglobulins exist for rabies, they are not readily available or accessible to those most in need. Treating a rabies exposure, where the average cost of rabies post-exposure prophylaxis is $40 in Africa and $49 in Asia, can be a catastrophic financial burden on affected families whose average daily income is around $1 to $2 per day per person. Every year, more than 15 million people worldwide receive a post-bite vaccination. This is estimated to prevent hundreds of thousands of rabies deaths annually. Prevention of rabies infection in humans can be supported by taking common sense approaches to interactions with animals. First, it is important to seek medical care for all bites and scratches. In the US, raccoons and bats are most likely to transmit the virus. However, other animals like skunks, foxes, and groundhogs are often bitten and infected by rabid raccoons. Wild animals that have bitten or otherwise exposed humans should be captured and local authorities notified to arrange for testing. Second, all dogs and cats should be vaccinated. Owners of other domestic animals such as ferrets, horses, and livestock should consider vaccinating their animals. An incentive for pre-exposure vaccination is that unvaccinated pets or domestic animals may have to be euthanized or isolated for 6 months to certify that the animal is not infected. Third, contact with wild animals should be avoided. Feeding, keeping as a pet, or encouraging contact between humans and wild animal populations increases the risk of exposure. Rabies can't be transmitted by petting. However, it is natural for wild animals to bite people that try to pet or feed them. Reducing contact can be accomplished by ensuring that garbage, pet food, and other sources of food are stored in animal-resistant containers. Fourth, control of domestic stray populations reduces the likelihood of exposure to humans. Abandoned and unwanted dogs and cats should not be left to roam, as they can contract rabies from wild animals and transmit to community residents and pets. Municipal services for animal control are available and will respond to complaints of strays or animals suspected of infection. Case management. There's no known effective treatment for human rabies once symptoms develop, but rabies can be prevented if immunoglobulin and vaccine are given shortly after exposure to the virus. This is called post-exposure prophylaxis, or PEP. When a patient presents with a bite, wound cleansing and exploration for foreign bodies, such as a broken tooth, are essential. Patients should be admitted to the hospital if the wounds are extensive or on the face and hands. Post-exposure prophylaxis is the immediate treatment of a bite victim after rabies exposure. A dose of immunoglobulin is infiltrated around the wound and given intramuscularly. This is followed by a series of 4 vaccines given over 14 days in the upper arm. This vaccine protocol has been used for many years with very few serious side effects and prevents virus entry into the central nervous system. The chance of a person becoming infected after an untreated exposure depends on the type and location of the exposure. For example, penetrating wounds, like a bite to a richly innervated area such as the face, are highest risk. Studies have shown that not all bites from rabid animals result in transmission. However, since there is no treatment, current recommendations are for all persons exposed to receive the post-exposure prophylaxis. Prophylaxis is 100% effective in preventing rabies when given properly, and this has contributed to the drastic reduction in incidence and prevalence in the US. If possible, veterinary services should be alerted after a possible exposure, the biting animal identified, and quarantined for observation, especially for healthy dogs and cats. Alternatively, the animal would be euthanized for immediate lab examination. Prophylaxis must be continued during this time, which is usually a 10-day observation period, or while lab results are waited on. In conclusion, rabies virus is a neglected tropical disease that exists in many mammalian reservoirs and is characterized by a progressive fatal encephalitis. The extreme nature of this disease prompted the development of a vaccine by Louis Pasteur in 1885. Pre- and post-exposure vaccines exist and have greatly reduced the incidence and prevalence of rabies in urban environments and in industrialized nations. Africa and Asia bear the burden of the disease, and cost of vaccine can be a barrier to widespread interventions. Post-exposure prophylaxis is safe and effective when applied properly, and has reduced the mortality and saves hundreds of thousands of lives per year. I hope this presentation has helped shed some light on rabies virus and can contribute to positive health outcomes for everyone in our community. Thank you, and have a good night.